Okay, so today's session is on, it's session 10 of the medical debate, and it's on futility, which is another type of ethical theory.
Right, so we're going to start by talking about what the role of a doctor actually is. So we'd like to take some suggestions at this point. You can type your answers into the chat, or you can speak out loud if you'd like to. Just think about what a doctor actually does and what their role might be, and just share your ideas on that if you can.
Please feel free to say anything, unmute yourself and tell us. We're more than happy to hear all of your suggestions. What do you think is the role of a doctor? To start us off, I'll say personally, I believe the role of a doctor is to provide the utmost care and health advice to a patient and to help them with their ailments. Does anyone else have any other ideas? You could just say yes. Yep, so one person said provide healing to a patient that is suffering. That's a great answer, yep. Anyone else? Maybe thinking of the Hippocratic Oath, or doctor's role is to provide care for the patient. In doing this, they must ensure they are doing no harm and work holistically. Yep, another great answer. Yeah, so I think those are two great answers, Shivas.
Yeah, so I think lots of people have got the general gist of it, which is, and most people would say the basic role of a doctor would be to treat patients, bring patients back to good health, to save lives. Yes, and all of the points you said were perfectly valid. But in this session, we're going to be talking about whether it's ever right for a doctor to actually refuse to treat the patient, and perhaps, not do one of these things. So that's something we're going to think about today, and that's the general topic of futility, which is the focus of today's session.
Right, so medical futility is where a treatment has been evaluated by the patient's healthcare team and or family as being non-beneficial, ineffective, or harmful to a patient. So that's quite wordy, but what that technically means is that where a treatment may be prescribed, but the doctor might believe that actually it's not going to help the patient, and therefore then they think we're not going to give them the treatment at all. And in certain cases, this could actually be the correct way to go. So there are two types of futility. There's quantitative futility, where the likelihood that treatment will benefit the patient is exceedingly poor. So basically, there's a low chance of the treatment actually being helpful. And qualitative futility, where the quality of the benefits produced by the treatment is exceedingly poor. Like for example, the quite a famous example is when people have amputations. Some people prefer to not get them at all, and some people prefer, some people believe that what kind of a standard of living would it be after you get the amputation? Right, so we'll just do a quick poll now. So I'll read this out and then I'll launch a poll where it says, drug A is a heart drug that can be used to treat heart attacks. Just any drug. When taken, it will work one time out of 100,000. So it has a very low possibility of actually working. However, when it does work, it can immediately alleviate the symptoms of the heart attack and restore a normal heart rhythm. I'm going to launch the poll, and I want you guys to think and answer. Is taking drug A quantitatively or qualitatively futile? Yeah, let's launch it now. Actually, Shivas, do you want to read the second question as well, and then I'll launch both at the same time?
Okay, yeah, so hang on, I'll just put it up on the screen. Yeah, so this is the second question as well. Drug B is used in chemotherapy. It can immediately target cancer cells in the brain, and it's 100% effective at destroying tumors. However, taking it will result in permanent loss of vision and hearing. So is drug B quantitatively or qualitatively futile? So if you can now, I think you might have to click on the polls section on the bar, and you should be able to see the polls here. So yeah, so I can see some people are voting already. So just, right, yeah, just put in your answers and then we'll discuss them.
Keep polling, guys. Keep answering the questions. There's two questions. And then we'll go through, what everyone said. There's 5 people still left to vote. Okay, I think the majority of the answers are in, and I don't know who else is doing it. But so majority of people think that for number one, it's quantitatively futile, and for number two, it's qualitatively futile. And actually, you would be correct. So re-describe the two options. Yeah, so the quantitative futility is when the chance of a treatment being successful or providing a good benefit is very low, and qualitatively futile is where the the consequence of a treatment is the quality of the treatment is not great for the person who wanted to know to re-describe the options. So
Yeah.
as Shivas will explain, actually, yeah.
So yes, so most of you are right for drug A. It is quantitatively futile, and that's due to the fact that it has a very low success rate. Although if you look at the question, it will immediately alleviate the symptoms of the heart attack and restore normal heart rhythm. So there's no actual damage to the quality of life. Whereas with drug B, although it's 100% effective, which means that it won't be quantitatively futile, it can result in a very large detriment to the quality of life, and therefore you could say it's qualitatively futile. So we're going to move on now. I think we'll end the polling. Yes, so you can see, yeah. And we're going to move on and think about a scenario which might help you, understand this a bit more, because it can be a little tricky to grasp. But Siddhant's going to go through this one with you.
Right. So this is a scenario that we're going to talk about, and it reads as follows. One of your patients, imagine you're a doctor, has suffered a stroke and is now brain dead. She has been put on a life support machine, and if you turn it off, she will die. However, there is a 2% chance that the patient will regain consciousness again while on life support, allowing her to potentially make a full recovery. The patient has opted in for organ donation. However, her organs will only be suitable for transplant for another hour. The patient's daughter lives in France. She's desperate to see her mother before she dies. She calls you, the doctor, and begs you to keep the patient alive for another day until she arrives so that she can say goodbye. So what would you do in this situation, considering what we just talked about, and also considering the 4 pillars of medical ethics? And just to remind you of what these are, this is non-maleficence, which is not doing harm, beneficence, which is doing good for the patient, justice, which is doing it legally, and
autonomy.
Autonomy, where you let the patient make their own decisions. See, there's so many factors. Even I got confused while making a good decision. So just everyone, put it in the chat. What do you guys think?
And actually, sorry, just to add, before you think about that, maybe think about also whether the treatment is quantitatively or qualitatively futile, and then just think about how this might affect your response and what you do in this situation. And just link your answer to the 4 pillars of medical ethics, and please put what you think in the chat, and we'd be happy to go through them. And also, if you'd like to speak out loud, then please go ahead. So we'll just give you a couple of minutes to do that.
Anyone have any ideas, just off the bat? Anyone? I mean, some ways to think about it are, think of the perspective of is the idea of putting keeping her in life support, is that is that fair on other patients? Is that respecting the patient's decision? The 4 pillars of ethics. And then also, is it quantitatively or qualitatively futile? Just write 1 sentence or 2 words, anything in the chat, and we'll talk about it. So, for example, someone said that I think I would keep the patient alive for the daughter to arrive. This would also allow for a conversation with the family to find out more what the patient would have liked in that situation. I think that's a really good answer, personally, because obviously you're meant to stay professional, but it's very difficult when you have, frankly, really moving scenarios such as this one, and you really want to let the patient's family talk to and discuss with you as well as the patient. So this would allow for a conversation with the family, which is good from your side as well, because you'd be able to talk to them about future steps. They may have signed a DNR request, a do not resuscitate request, and I personally think it's a good idea. Shivas?
Yeah, so I think that's probably what I'd do as well in this situation. I would keep the patient alive because for the daughter to arrive. Although I can see why some people would disagree, and hopefully some more people put their answers in the chat. Maybe why you could give some reasons why a doctor might not keep the patient alive. So we'd really like to hear from you. So
Is it okay for me to speak?
yeah, sure, go ahead.
So, I would have gone with the option of keeping her alive as well, but thinking of some arguments like against it would probably, you could base it around maybe autonomy, since the patient had opted in for organ donation. Like obviously, even if you opt in and you die, your family can still like argue against you opting in, but like even despite that, it was still her decision, and she made an informed decision to opt in before she died. So there's that. And then secondly, you could maybe talk about, I guess, beneficence. No, in this case would be non-maleficence, because say that you are, say that because you're choosing to keep her alive, which means that she's not, it's not viable to have our organs transplanted, how that could maybe have a knock-on effect on another patient who's maybe waiting for organs, who needs it to save her life. So you could argue by keeping her alive, you're performing maleficence. So yeah, there's just some arguments that I would probably like in an interview scenario I'd like put against, but my like obvious opinion would be to like keep her alive. But yeah.
I mean, I thought that was an excellent answer. I thought it took into account all the factors as well as being informed. And so we're just going to see how the 4 pillars of ethics would weigh up against what we wanted to do. So where it says beneficence, there is a small chance that the patient could survive if you keep her on life support. So in beneficence wise, it would be in your best interest to keep them alive and on life support. Shivas, do you want to do non-maleficence?
Yeah, so obviously, as you said, people could die due to not receiving organ transplants, and I think that's a really good point to make. Even if you don't agree with it, even if you don't think that's that's what should happen, then it's very it's important to point out that that could very well be a knock-on effect. And in an interview, that would be a really good point to make. There are several people waiting for these organs, and if you let this patient die, then you could even though you'd be losing one life, you could be saving potentially many others. So that's, yeah. And so that maybe you can go through autonomy.
Yep, so autonomy is the patient cannot make her own decision, but her daughter can express a view in her mother's interest. Oh, so that's really, yeah. And I was just going to say, but if her daughter is over 18, I think she can do that. But under 18, I don't think she does have the ability to do that because she's a minor. But yes, the patient cannot make her own decision at this point because she's not able to do that. And so autonomy wise, again, it would be better to wait for the daughter to come. And actually someone pointed out that at this point the organs would belong to the patient. Can you really consider that another patient would be entitled to those organs? So that's, again, autonomy comes on top of that, because if the patient has opted in for organ donation, it's really tricky, because organ donation only happens after the patient is declared dead, and if the organs are completely viable, are still viable for harvesting and storing. I'll double check that. I'm not completely sure about that, but I did watch a documentary about that, and it's important to realize that if she has opted in, if she is declared dead before the deadline for the for the organs not being able to be harvested later, that means that yes, we can argue that the organs can go, but I don't think we should make a decision on whether to keep her on life support or not solely based on the fact that she's an organ donor.
Yeah, I'd just like to add to that, about, that point about another patient being entitled to those organs. I think that's a really good point to make. That's really, because you're absolutely right. Those organs don't belong to anyone else. They belong to that patient. And, keeping that patient alive, you know, you could do that and save that life. And no other patient, if that patient had died anyway, and they hadn't signed a, you know, they hadn't opted in for organ donation, then those organs wouldn't be given to someone else. So, you know, I think that's very, very true, and a very good point to consider. And also just to you know, talk about justice, you know, about the life support machine itself. You could argue that it's been being wasted on that patient where it could be used for someone else. And I think the same principle applies here, about being entitled, because you could just as easily argue that this patient is entitled to the life support machine just as much as any other patient is. So letting this patient die just to help save another one, you know, that might not necessarily be justifiable, because you know, because you're right, they're not entitled to it. Yeah, so Sidan, do you want to add anything, or maybe we can move on?
No, let's move on to scenario 2.
Okay, yeah, so we're going to move on to the next scenario now. I'll just read through it. One of your patients, a 9-year-old boy, has been diagnosed with a type of terminal lung cancer. If left untreated, the tumor in the lung would spread and the boy would then die in the next few days. It's possible to perform a complicated surgery to remove the tumor, which would give the patient another 20 years of life, and the surgery has an 100% success rate. However, the surgery would last 3 days and require 8 surgeons to be present at all times, meaning it would be hugely costly. The boy is currently in extreme pain and he finds it very difficult to breathe. The surgery would not alleviate his suffering. He would continue to feel this pain constantly throughout his life, and there is no medication which can help him deal with this. The boy and his parents have told you they would like to go ahead with the procedure. So let's think about this one and just you know, unpick it in the same way we did for the last question. Maybe you could start by thinking about whether this is quantitative or qualitative futility. You know, you can just write that in the chat if you'd like, which one it is. And then also, if you'd like to talk about the pillars of medical ethics and how that relates to your response, we'd really like to hear what you do in this situation. And then, like we did last time, weigh up, you know, other people's opinions and you know, the pros and cons as well. And as always, please feel free to unmute yourself if you'd like to talk out loud.
I think we'll give them, 5 minutes to just read through again. And
Yeah, it'll just take a couple of minutes, yeah.
Suggestions.
Right, so yeah, someone has put in the chat autonomy, the patient and his parents. So yes, you're right. In the question, it does say the boy and his parents have told you they'd like to go ahead with the procedure. So if you refuse to treat the patient in this situation, then that's going against their decision. And obviously that's different to the last question where that wasn't the case, where the patient hadn't actually said their opinion about whether they wanted the treatment or not. And yes, non-maleficence, the idea that the patient will continually suffer even with an extended life expectancy. That's very true. And that also links to beneficence as well. On the one hand, you are saving the life, but on the other hand, you know, at what cost? You're, you know, ending their life now would perhaps, you know, if you let them live, then they would live 20 years in constant pain, in constant suffering. And is that really worth it? And I think that also links to, as Siddharth mentioned earlier, many patients sometimes say they don't want to be resuscitated. And that's often because of brain injuries. You know, they don't, if the damage is so much that their brain will be injured and they risk leading a life, you know, living, but having brain injuries and not being able to speak, not being able to, you know, have memories and stuff like that. They don't want that life. They'd prefer to be dead. And I think that's very important. So yeah, lots of people are writing in the chat now. Yes, and financial harm to the hospital. Yeah, of course, that's a very big point about resources. You know, you've said it's you know, the question says it's a very large cost to the hospital. Lots of surgeons are being used. It would last a long time. Could those surgeons, perhaps each of those 8 surgeons, be treating 8 other patients at the same time? And this links back to what we were doing at the very beginning of the medical debate in our first few sessions, talking about, you know, should you kill one person to save a few others? And yeah, we've got lots of messages coming through. Yeah, so someone's asked.
Well done. We want to encourage talking
Yes,
and communication.
absolutely, yeah. So someone's put, would this scenario be qualitatively futile, high success rate, but suffering will remain regardless of treatment? Yes. Yes, it would, because you can see the surgery has an 100% success rate. So there's no, you know, we know that it is going to work, but, you know, obviously it has a huge detriment to the patient's quality of life. And yeah, so someone's put, yeah, is the treatment qualitatively futile? It is. Yes, someone's made a very good point actually about whether the patient actually knows the risks. Yeah, so the patient does know the risks of this treatment, so the doctor wouldn't be entitled to go against this decision. So it is actually the doctor's choice at the end, but they do have to take into account the patient's autonomy. Qualitatively futile. Yeah, so someone has Kim Wilkins. You've summarized it very well here. Yeah, there are obviously pros and cons to this treatment. Obviously, you get many years of life, but the huge discomfort for the patient probably might go against that. Yeah, autonomy is definitely important. Yeah, you've made a very good point about developments in technology. Yes, so although the boy cannot be treated, their pain cannot be treated now, perhaps in the future they will be able to be treated, and therefore it might be justifiable to go ahead with this treatment. Yeah, that's a very good point as well. So I'll just put on the screen now the just some points that we've got here. Yeah, so yes, as you've said, the patient will be able to live a long life, become an adult. Patient's parents would be far less emotionally distressed. Obviously, the patients would not want to bury their own child. They don't want their son to die, but at the same time, the parents don't want the boy to suffer, which he would do if he went ahead with the treatment. And autonomy as well. They've expressed they want to go ahead with this. And justice, you know, is it worth spending so much money and so much time on one patient where other patients could be treated? So for me personally, I would, if I was the doctor in this situation, I would go ahead with this treatment, mainly because it's what the patient has requested to do. If they had requested not to do it, then I wouldn't, because obviously there are, you know, it's up to the boy himself, because it's his life that's going to be, he's going to be in this pain, and it's up to him whether he wants to live with that or whether he should die and then, you know, avoid that pain. So Siddhant, do you have anything to add here?
Yeah, I think also there's a fine line between autonomy and using your professional opinion, because obviously you want to respect what the patient has to say or wants to do. But again, with the example of whether you want whether you should let the patient die, I think, you know, that's erring on the side of euthanasia. And I do believe that obviously that's illegal here. And I do believe that if their pain would just last a tiny bit longer, but then after a treatment, it would be solved, and they have the possibility, and then they don't consider dying and they live a fruitful life after that. I think that's much more important, and that should be your professional opinion, not just simply saying, do what you like, because there's autonomy, and then there's just letting them, fend for themselves, which is not okay.
Yeah, so that's very good. And you've all made some really good points. I think that point about, you know, the technology improving, that's a really good one, which I hadn't actually thought of. But you're absolutely right. If in the future, you know, they could actually be able to treat his pain, and that could be, you know, that would obviously reduce the costs of this treatment massively. Yeah, so those those two scenarios were questions that you might be asked in an interview, perhaps, where you've been given a lot of information and you have to kind of work through it and think about this. And so now you've seen some reasons in these scenarios why doctors might decide not to treat patients, why they might refuse to treat patients, which is the whole point of futility. So we're going to now think about how we can apply this to a BMAT essay question. And we've done a few of these in the past, but this one, I'll just read it out loud. Doctors have a duty to always treat their patients regardless of the situation. To what extent do you agree with this statement? So in the actual BMAT, the question would be it would be phrased a bit differently, because you'd be given a few questions and then some points you have to address. But I've just kind of cut those bits out so we can focus on this. And we're going to think about how you can talk about futility when answering this question. And this links back to what we were talking about at the beginning. Should a doctor ever refuse to treat their patient? Is it their duty to treat patients regardless? Or are there situations in which it might be more beneficial to not treat the patient? So we're going to split this into for and against. And again, you can use the chat if you want to. I think Siddhant's going to go through the 4 points and then I'll go through against, but let's start with 4. So if you'd like to share your ideas, why should a doctor always treat their patient? Why should they do this? What are the reasons why they should always go ahead with it? So please put your answers in the chat and Siddhant will go through those.
Yeah, so why should a doctor always treat their patient, guys? Like, just any suggestions you may have. Anything. So someone says treatment can elevate suffering. Do you mean alleviate? Duty of care to make the patient's health better. Yep, so it is alleviate. Okay, duty of care, make patients better. Yeah, perfect. So Shivas will now put on the 4 side and actually that's right. Treatment.
Actually, we'll do that after. We'll just go through the points first and then.
Yeah, cool. Sure.
Yeah, but I think people have, basically got it. Autonomy to, it's their duty. As we said at the beginning, the role of a doctor is to treat patients, to bring them back to good health. Yeah, and now perhaps let's think about the other side of it. Why might a doctor...
Sorry, I just wanted to talk about one of the points that someone made.
Oh, yeah, sure.
Yeah, one person just said that duty of care, and I think that's a really important point. I mean, all of these points are super important, especially the last 2 ones, which are using the 4 pillars of ethics. But duty of care comes under the Hippocratic Oath. And obviously, some people consider taking the oath, but then not living up to it fully. But it's so important that you follow this oath because it is an oath. You have promised to help people as you can with the knowledge bestowed upon you. And it's so important that, yes, you have a duty of care. And so you should try and help people when you can. That is so important. So well done for thinking that. Yes, Shivas.
Yeah, so no, that's a really good point. And lots of people have put in other things linking to the 4 pillars of ethics, which is important. And you should always do that in these questions. So beneficence, treatment may aid suffering. But obviously it does depend on the situation. And in this question, you might be given a bit of background information. But you're right, if the patient just wants to go ahead with the treatment, then it might be the doctor's duty to do that. And even if they don't want to, then it might be the doctor's duty to do that as well. So now we're going to think about the other side and why might a doctor refuse to provide a futile treatment? And so think back to the examples that we've had and what were some of the reasons why a doctor might be, find it difficult to, say yes to a treatment. Yeah. So, oh yes, someone's also put personal views, religious beliefs, refusing to help seek abortions. That's very true. Yes, that's true. And that links to autonomy as well, about the patient's decision. Treatment may not be suitable for a patient. Yes, that's very true. Although I don't know if that necessarily links to this, because I think the doctor would take that into account. They wouldn't offer a treatment which wouldn't be suitable. But yeah, it's very true. If the treatment had side effects, perhaps negative side effects, then from a doctor, that would be detrimental to the patient. The doctor might say no. Yeah, someone's also put capacity. That's very true. The doctor, they can't make informed decisions. So the doctor might say, might have to advocate treatment and say or they might have to say, no, we can't provide this treatment because, you know, the patient doesn't really know about the full risks of the treatment. Yes, someone's mentioned again side effects, poorer quality of life. That links obviously to the qualitative futility.
For the religious one, I think that was a really important point raised, because obviously lots of people will have religious forgotten the word for it, but will have, you know, objections to different kinds of treatment that may be possible. But then you also have to consider people that are against abortion probably wouldn't become the medical practitioners in charge of abortions. And not only that, but then it's, you have autonomy as a patient, and as a doctor, they'd either probably consider consulting their consultants and asking them what they can do, you know. But again, you have to respect the patient as a doctor. You have to respect the patient's wishes.
Yeah, absolutely. And I think also that links, you know, the doctor in this situation. I don't think, if you could argue that a doctor might not provide a treatment because it goes against their own religious beliefs. Like you might say, perhaps a Catholic doctor might not want to assist with an abortion. But this, I think, wouldn't be morally right, in the sense that I don't think it's the doctor's decision to make. They have to be neutral in the situation. They can't have their own, you know, they can't let their own beliefs get in the way of what's best for their patient and their patient's belief. And yes, Aisha, you've put low success rate doing the treatment would do more harm than not doing it. And that's, of course, linking to quantitative futility. Yeah, the doctor needs to balance out the benefits and risks of the treatment. Yeah, of course they do. And that's how they would make their decision. Yes, someone's put a very good point here. According to the GMC, the doctor can opt out of treating to ensure the patient can go to another doctor. Opt out of treating the patient if they have a moral objection. Yes, and that links to autonomy as well, about, you know, the patient's choice. Yes. So yeah, and they can ensure the patient can go to another doctor, and that's very true. If patient doesn't think a doctor is providing them with, you know, the care they need, or prohibiting them from having a treatment, then they can go to another doctor. Yeah, so you've all put some really good points here. So I'm just going to put up on the screen some of the points we've got here. And you've all basically said them, and you've put in a few extra ones as well. Obviously, you know, a doctor should always treat their patient because it's their duty to do so, and it increases their chance of survival in many cases. And, you know, links to beneficence, always treating the patient and doing what's best for the patient. And it respects their decision if they want to, if they, you know, want to go ahead with the treatment, which links to autonomy. And obviously, keeping a patient alive may reduce the emotional distress caused to friends and family, is another point, which we touched upon earlier. Of course, with the patients we had earlier, with their family would be very emotionally distressed if the patient were to die. And against, so some of the points against, the treatment may increase a patient's I should say, pain and discomfort. Yeah, of course, and that links to qualitative futility. Like the boy we saw earlier, he would live a life of pain. You know, that could be a very big reason. The treatment may give patients and family false hope. That's especially true when there's quantitative futility. If a drug has a 1 in 1,000 chance of working, obviously that's very low. And if the doctor offers this treatment to the patient and says, there is this treatment available, the family and the patient themselves might think, oh, you know, we should go for it because, you know, you know, it could be really useful for me. Although they might not really know or understand that, it's most likely that it's not going to help them, and it might give patients and family false hope, when in reality the patient is going to die or going to suffer regardless. And another point, which I don't think anyone's mentioned yet, is it may delay palliative and comfort care. So in the final stages of patients' lives, they're put into palliative care, which involves not necessarily treating them to, you know, remove the cause of what's happening. So, for example, cancer patients wouldn't necessarily be given chemotherapy during palliative care because they're at the stage where they are going to die regardless, and it's not worth doing, you know, providing those treatments. And instead, doctors should be focusing on making it making those patients' lives the most comfortable they can be. So giving patients painkillers, for example, and making them comfortable and calm before they die, rather than trying to, give them drugs and stuff which perhaps would stop, be used to treat them instead. And the last point, which we've touched upon quite a lot, is about medical resources. Obviously, the NHS has, a limited amount of resources to treat patients. And we talked about, various drugs and treatments, surgeons, doctors themselves, life support machines. These are all finite, and they could be used to treat others. And, that extends to organs as well, people's organs, which could be used to help others. And that might be a reason why a doctor might refuse to provide a futile treatment, because it's futile on one patient, but it may not be on another. Yes, so I think that covers it. Oh, someone said, I can't see the screen.
Don't worry, Shavas, we're sorting that out.
Okay. Right, well, I think we've touched on the main points. Can you see it now?
No, he says no.
Okay, well, I think...
Let's carry on for now. We'll sort this out later.
Right, it's okay, because I think we've more or less come to the end of the presentation, but you've all made really good points, and I think I've addressed the main ones. So yes, let's shall I perhaps disconnect the screen share and do it again?
No, we'll carry on for now, but I'll sort it out later.
Okay.
Yeah.
Right, so we'll just move on to the end. Sidan, do you want to go through this?
Right, so this is the reality of refusing patient treatment, and sort of a summation of what we were talking about in the futility topic. So should a doctor ever refuse to treat a patient? And what the NHS says is that although the role of a doctor is to help ill patients, they have no obligation to offer treatments that are futile, which basically means that as doctors, you do not have to give treatments which you believe are futile using your professional opinions. You're trying to help the patient, and if a treatment doesn't help the patient, it's complete waste of resources to try that treatment. So in a real life situation, the doctor would take into account the patient's requests, which is autonomy, and the four pillars of ethics. But it would be up to them finally to determine a course of action, and decisions should be made on a case-by-case basis. Like, there's no one-size-fits-all for medicine. It's not an exact science, and for each single case, there will be different factors to consider, different information, and different moving parts and variables that the doctor will consider. So it's very important that you realize that sometimes, it's the decision is made using the facts present and the doctor's professional opinion.
Yeah, absolutely. And I think this is kind of what the NHS says about the matter. And now I hope you've realized throughout the course of this webinar that, at the beginning of the webinar, you might have thought a doctor should always treat their patient as it's their duty to do so. But now hopefully you've realized that in some cases, that's not the case. And it might be in the best interest of the patient to not provide treatment, or in the best interest of other people. And as Sinan said, it should be dealt with on a case-by-case basis. You should take into account all the different factors, like we did in the two scenarios, and then the doctor should make that decision based on all the factors, taking into account the patient's autonomy, taking into account the success rates, whether it's quantitatively or qualitatively futile. Yeah, so this is the kind of summary of what we've said. So that it's up to the doctor at the end of the day, but they should take into account all these factors. Right, so I think that brings us to the end of our presentation today. I hope you enjoyed it. And I apologize if there were any issues with the screen. I know one of you couldn't see it. But I think we've said all of it out loud, so hopefully you would have got that information anyway. So yeah, if you have any questions, please ask them now. And if you feel free to contact us on our email here, or on our Instagram. And please do follow our Instagram to keep up to date with our sessions. We'll provide the link there, and also any guest speakers we have. And I'd also like to say, I know it's been a bit busy now with lots of people going back to school. So best of luck, everyone, going back to school. And obviously we'd love it if you can stay watching our webinars along the side, and I think it will really help with your careers and university applications and stuff like that. So yes, and best of luck with school and everything. So yeah, please do ask any questions if you'd like to. Yeah, thank you. Someone said webinars are brilliant. Thank you very much. Yes, someone has asked if treating the patient could achieve reversal of the disease, but would in the process put others at risk, what is the obligation for the doctor to treat the patient? Right. So that's very interesting. I don't know a disease which would do that. Yes, but I assume treating a patient and eradicating a disease in that patient would. Okay. So yeah. Well, in Ebola, for example, yes. So that's true, and again, I think it's up to the doctor to take into account a range of situations. If say this is in a country where it's that they can provide good enough treatment to stop infection, and the infection rate can be quite low due to good personal hygiene and stuff like that, then they might decide to go ahead with the treatment. Whereas if it's in a developing country where there is poor sanitation, and perhaps there's a large population density and stuff like that, where the risk would perhaps be a lot higher, then the doctor might not go ahead with that. So yeah, it's there are a range of points to consider. I don't know, Siddhant, if you want to add anything.
Yeah, so adding on to Shivas, I mean, don't have much to add, but like you said in Ebola, that's what I was thinking about, and especially with coronavirus right now. Some doctors have to wear hazmat suits to treat patients. So actually in that scenario, they're well equipped and they are very unlikely to get the disease with such protective headgear and protective equipment on. And therefore they can save the patient, and therefore should, using the treatment. Although again, you have to maintain your hygiene properly, because if you don't, and if you pass on the disease to someone else, that's on you, and that's not okay. So the patient, protect yourself, and therefore protect others as well with such contagious diseases. And so one person says, I guess the people are at risk are healthcare professionals in this scenario, and healthcare professionals have known that they've signed up for. Yes, exactly. So healthcare professionals are such dedicated people. They are so loyal to their profession, and they're trying to treat people. And if they are at risk, that's why they wear hazmat suits and stuff, to keep our frontline workers safe. And that's why, again, they need to maintain hygiene, and so do we, to sort of protect everyone, kind of like a herd immunity type of thing. And Shivas, if you wanna touch upon the last few comments.
Yeah, so someone's put a very interesting comment here. If a patient has reduced eyesight, for example, and the doctor advises them to stop driving to keep themselves safe as well as others, yet the patient refuses and says they will continue driving regardless as they must get to work/travel, what would be the course of action in this case? Reporting them? So I think that's a very good point, and a very good scenario to think about, because yes, obviously if a patient has reduced eyesight, poor eyesight, then it would be safe to stop them driving. And I believe the laws in this country say that people who are blind aren't allowed to drive, but I'm not too sure about that. But yes, you're right, and I think I don't know about reporting them, but it would.
Yeah, so just wanted to interject there. I've actually seen that, yes, it is your duty to tell the DVLA, and I think someone's actually put it as well. It's the doctor's duty to report them to the DVLA according to GMC. Yeah, exactly. That's what I thought. I've seen that before, that you do have to do that, because that is a huge, huge risk. If that someone has such bad eyesight that they could cause accidents, that's something that definitely needs to be reported.
Yeah, absolutely. Yeah. So they should report them in that case, yeah. And yes, you're right, it would pose a very large risk to everyone else, and patient confidentiality wouldn't matter. Yes, I suppose you're right, because they are directly posing a risk to other people. So it's important that other people, especially, you know, the DVLA are made aware of it. So yeah, that's a good one to think about. And as well as patient autonomy, you do need to take into account in these scenarios the effect on other people, sometimes more so than that of the patient themselves. So yeah, and anyone else, if you have any questions you'd like to ask, then please do go ahead.
Also, guys, if you have any suggestions for future episodes, I mean, we always plan things, but we're happy to take on suggestions and do things that you guys might want us to do, or call on speakers from a certain professional thing. So please, please, please tell us, and feel free to tell us. Otherwise, guys, thank you very much for coming, and we hope you learned something. We hope to see you in future sessions, and actually we've got some great sessions planned for the future. So thank you all for coming, and we hope to see you again. Goodbye.